Medicaid expansion has become a very hot-button issue since the Supreme Court case in 2012 said that states can decide whether or not to expand their Medicaid programs. Each state has approached that decision in a very different way. Michigan decided to approach that in a very unique way, passing its program in late 2013. And it's one of 6 states that required certain modifications to be made that got approved by the Centers for Medicare and Medicaid Services. Because of these unique requirements, we thought it would be really interesting to take a closer look. One of the unique requirements was that new enrollees had to obtain an appointment with a primary care provider within 3 months of enrollment. So we started the study specifically to look at that question. How easy was it to get an appointment? And then if you got an appointment, how long were the wait times? Could you get it within that 3 months that the state told you had to? For me, what was surprising is that the findings were much more optimistic than I think a lot of people predicted. So after Medicaid expansion, even though hundreds of thousands of individuals enrolled very quickly in the first few months, which was a lot more than anybody expected, there were increased availability of appointments for new Medicaid patients. What was also interesting is there was a slight decrease for new privately insured patients, but for both new Medicaid and new privately insured patients, there was no significant change in wait time. So they didn't get significantly longer, and the median or average wait time was within 1 to 2 weeks. So I think overall, the study findings have been much more optimistic that new patients, will have the availability of appointments to get in to see new primary care providers, and I hope that in that process they can establish care and get their health needs addressed. We'll look at more of these questions with the Institute for Healthcare Policy and Innovation overall evaluation of this Medicaid expansion program or the Healthy Michigan plan to see what are the experiences of new enrollees, how are their care providers taking care of them, what are the factors that help them provide that care, and then I think we'll see a lot of downstream outcomes in the years to come.